Now, in contrast to a prospective study is what we call a retrospective study. A retrospective study does basically the opposite. That is, if we visualize ourselves as standing right here in the present, a retrospective study looks backwards. That is, right now I go out and ask people about events that have happened in their past, about behaviors or habits they had when they were younger. So retrospective looks, once again, towards the past. A good example of this would be studies that happened in the late 2000s, early 2010s, which looked at whether or not breastfeeding was related to the IQ of a child. So, breastfeeding and IQ. So what researchers did is they went out and they found mothers of 5, 6, 7, 8-year-old children, and then they asked them, how long did you breastfeed for? And they used that data and an IQ test on the children to try and find a relationship between these two variables. This is retrospective because they went out and asked mothers of older children, how long in the past did you breastfeed for? Now, there are advantages and some shortcomings of this type of study. So let's talk about advantages first. A really good advantage is that it takes very little time to do this type of study. That is, they went out, they found the mothers, they asked them the questions, and they immediately had data off of it. They didn't have to wait for the children to grow up or the mothers to stop breastfeeding to get the information they wanted. So time is an advantage in retrospective studies versus prospective studies. The shortcoming, though, is pretty significant, and that is accuracy. That is, if I go out and I ask a mother, well, how long did you breastfeed for 6, 7 years ago, she might not know to the exact day. And even the accuracy that she remembers, she might round it or approximate it when she reports it. So time is on your side if you're doing retrospective, accuracy is on your side if you're doing prospective studies. Now, I really want to emphasize here that while retrospective and prospective studies are types of observational studies and they have their separate pros and cons, the really big overarching thing you have to take out of observational studies is, once again, there is absolutely no causation. That is, while we can go ahead and draw parallels that, for instance, we might say that it looks like breastfed babies in this case had higher or lower IQs, we can in no way feel justified in claiming that overall, of course, breastfeeding does this or this. An observational study lacks control, which means causation is off the table for us.